Good afternoon, everyone, and thank you, TIA, for this opportunity. This is my second TIA, and I'm really excited, and thank you so much. Well, I'm Dr. Adarsh. I'm a minimal access surgeon and founder of V Medical. I'm introducing P-Scope, world's first scope for abdominal cavity examinations. Sorry. Well, endoscopes have transformed medical science and they are used for examination of body cavities. Approximately 250 million procedures are performed every year, and there are 10 major types of scopes. For example, a colonoscope for a colon, a cystoscope for a bladder. So we have developed a scope for abdominal cavity examination. Our vision is to make abdominal cavity examination accessible and safe. The problem we are solving is that the present process of abdominal cavity examination is very complex. Whenever there is a problem in the abdomen, patients have to first undergo an X-ray, ultrasound, CT scan and a PET scan, which have their own limitations. They have risk of radiation, they're often inaccessible and inconclusive. So these patients in turn have to undergo invasive tests like a diagnostic laparoscopy or a diagnostic laparotomy, which is an inpatient procedure, requires anesthesia and a surgery. So we have simplified this process. We give local anesthesia on the abdominal wall, a tap block. If required, we confirm the needle position. This is the disposable device. It's completely disposable. It has an optical port, camera, light source, a balloon to insufflate atmospheric air, and a screen to visualize inside. We make a small nick. We introduce this device inside under vision, and once we are inside, we put some atmospheric air to make some space inside the abdominal cavity. Then we introduce this device inside and we can have a look inside the abdominal cavity. So these are the intestines, and if required, this is the liver, and if required, we pass a biopsy forceps and take a biopsy as well. It has a feature for irrigation and suction as well. So release all the gas, take out the port, and patient is completely awake because this procedure is performed under local anesthesia. So it's an minimally invasive procedure. Basically, we are converting an inpatient procedure to an ambulatory procedure performed under local anesthesia. Hence, it's painless, convenient, and it's cost effective. If you compare it to the existing technology, the laparoscope, they are very expensive. They cost up to $90,000, whereas our device costs $1,000. They're bulky, require sterilization. Our device is portable, disposable. They require multiple ports, whereas we have a single port and can be performed under local anesthesia. So it has multiple compelling applications, one of them being patients admitted in ICU with abdominal sepsis. These patients have very high mortality rate because they are sick at presentation, they are on ventilator, dialysis. So transporting these patients to radiology or operating room is not safe. So in these patients, we can perform these scopies inside an ICU. We can go inside in the bedside, have a look and come to a definitive diagnosis. It has other compelling applications in staging of abdominal cancers, to identify peritoneal secondaries, in emergency care for timely and effective treatment in golden hour, for example, blunt trauma abdomen or military field hospitals. It has some exciting applications in perioperative care and some future applications as well. So the potential being abdomen has 10 major organs. We have multiple compelling applications. Our manufacturing cost is $100. We intend to sell these devices at $1,000. We need to generate 1 million procedures to generate $1 billion revenue. So the total market size for endoscopy globally is around $40 billion, and in that the market size for laparoscopy is around $15 billion. Out of this, the 25% of these procedures are diagnostic in nature. That makes the sum of $4 billion. This is a novel device. We have been granted a utility patent for this device. The endoscopy market, disposable endoscopy market, is growing at 17% annually, and also the minimal access surgery market is growing very rapidly. So we believe this is an ideal timing for this device. As of now, we have received our FDA clearance for this device, and we have achieved an IP patent, an FDA clearance, and contract manufacturers with 250K. We are looking to generate $1 million to generate our first sales and supporting clinical data. And by 2026, we intend to generate another 4 million to get clearance in regulatory clearance in EU and Asia as well, and expansion in multiple indications. And we intend to target a revenue of 50 million by 29-30. And with this revenue, we would look for an exit with an IPO or an acquisition with a potential exit of around $500 to $800 million. So we have a very cost-efficient go-to-market strategy. We have tied up with Acuity MD, which provides us high-value physician leads, and we have also tied up with Sanford Rose, which provides us nationwide 1099 workforce, and we are also tied up with Unifor Logistics, which is a life science distribution company, so through which will store and distribute our devices. So there are approximately 20 large OEMs in the market, like endoscopy market, like Olympus, Ambu, Strauss, Boston Scientific, etc. We are a good strategic fit for them. We are already in talks with Strauss, and we are also incubated at J&J labs at Texas Medical Center, and we have been placed in their Ethicon portfolio. This device is a platform to access abdominal cavity under local anesthesia. So that brings in new opportunities for new therapies and new products. Some products are in pipeline. So our strengths are patent granted. It's a novel device, FDA cleared, which shows the safety and clinical applications of this device. We have supporting clinical data, which shows compelling applications. We have validation as we have completed a University of Massachusetts M2D2 accelerator program. We are presently incubated at J&J Labs at Texas Medical Center. We have received interest from Stanford and Mayo Clinic, and we have also completed a Health Wildcatters MedTech accelerator based in Dallas. So I'm Dr. Adarsh. I'm a founder of this company. I'm a minimal access surgeon with 15 years of experience. I have experience of two MedTech startups. Thomas is a co-founder, and he has 30 years of leadership experience in MedTech with 3 exits. Suzy is an advisor and a healthcare innovation leader. And Dr. Stephen is a surgeon and a former medical officer for FDA. He was great with help with FDA. Thank you. Thank you very much.